Hey there, this is Dr. Tall Paul Simon, psychiatrist. Just wanted to talk to you about ADHD or ADD, how it's diagnosed, and there's another video about how it's treated. So if you're wondering if you or somebody else has ADHD, just wanted to share some information about that because it's a lot more complicated than I think a lot of people believe. So ADHD stands for Attention Deficit Hyperactivity Disorder. Okay. ADD is an older term, attention deficit disorder. We don't use that a whole lot anymore, though it's still commonly used to a lot of people. So ADHD, nowadays you can go online and look up the criteria and different things and get an online diagnosis from places like ADHD.com or whatever. And a lot of those places do evaluations that are rather cursory and they don't rule out a lot of other things. So I'm not a big fan of those very simple, relatively simple, but not cheap assessments because they don't do a really good, thorough job of assessing, for other things and whether somebody really has ADHD or something else. So, how is ADHD diagnosed? Okay. Now, and I'll get into what ADHD is a little bit later. But ADHD is really an issue that comes up in childhood. Okay, it doesn't start in adulthood. I know there's some misinformation about that, and I blame the drug companies for that, clouding the waters and confusing people. Really, ADHD is a disorder of childhood, and basically, it starts before puberty, and it's obvious to the people around them. Now, when you're trying to assess somebody, you have to establish the fact that ADHD symptoms like attention problems, focus issues, hyperactivity, first of all, are causing a lot of problems. Like it's an issue. It's not just, a little bit annoying to a teacher, but it's really causing problems in a lot of different situations. So at school, but also at home, maybe at church or on vacation or in the neighborhood or just around in different places. So it has to be in multiple different settings, not just one. Okay. But also in that young person and in adults, you really have to be very careful and thorough in ruling out other causes for the attention problems. Okay. So, for example, in a kid or an adult, you got to rule out depression, you got to rule out anxiety or sleep trouble or other mood problems, bad, habits, or is there a lot of chaos at home in their personal life? Are they grieving? So, because concentration, attention, and executive function all can be impacted by any of these things. So you don't want to assume that somebody has ADHD if there's other things going on, or there's health problems, or sleep apnea, or asthma, or vitamin D deficiency, or whatever. So you really have to rule out all these other things. And I see a lot of these online kind of resources or evaluations, even from primary docs and some psychiatrists, honestly, really not doing a deep, thorough assessment. So I get a lot of people who come to my office saying they have ADHD because it was diagnosed online or by the primary doc. And when you really dig deep, you really don't have ADHD, but they're so wedded or committed to that diagnosis, it's hard to get them to take that deeper dive into really what's going on because it's usually not just one thing going on in somebody's life causing them problems, right? So even if, let's say, I get an adult who, let's say, only has the inattentive type of ADHD. There's two types. There's three: inattentive, hyperactive, and combined. So a lot of times, people with the inattentive, you know, especially females, will fly under the radar because they're not having a lot of behavioral problems in school, for example, or in their life. So as a kid, so they'll kind of fly under the radar and eventually, keep running into problems in their life, in the workplace or different areas where their attention problems really are more obvious. Maybe they're really smart and they like, book learning and all that as a kid, and they just kind of scoot by under the radar. But when they get into grad school or college or something like that, or a challenging work environment, that's when it's more obvious. So even then, you have to really be careful to rule out all these other things. Are they having relationship issues or sleep problems or health issues? Is their thyroid off? Are they drinking too much? Are they smoking a bunch of marijuana or, using gummies at night? So there's all these things you have to rule out before you can conclude that the person has ADHD. And you have to always look and see, okay, were there problems as a kid before puberty, essentially? You really, you may not have to officially diagnose them with ADHD, back then, retrospectively, but you really want to establish that there was, in fact, a problem. Now, there are thorough testing kind of approaches that are becoming much more common and the standard, which basically tries to minimize the subjective experience or reporting of ADHD symptoms. So, and make it more an objective test. So a lot of these are computer-based tests, and really look into reaction speeds and stuff, and they can kind of see if somebody's trying to game the system too. So they also try to get history from somebody who knew you when you were a kid, but also people around you currently. They also try to ask, okay, what does this person really look like they're doing or not doing as far as ADHD and symptoms that they're struggling with. So it's a much more thorough, comprehensive evaluation. And usually that's done by a psychologist, all those that really deep testing and stuff. A psychiatrist, a therapist, primary doc, they can all diagnose ADHD, but they're not always as thorough or standardized as maybe one of those really deep, thorough PhD level psychologist evaluations. So I think that's about it. If you have other questions about ADHD diagnosis and stuff, please ask in the comments. I'll post another video. Please subscribe to this channel. Another video will be about ADHD treatment options and things, okay? And of course, I'll always emphasize ruling out other things. That's so important, okay? All right, take care.